So next topic we'll be discussing is the short bowel syndrome. So what is short bowel syndrome? It is a clinical syndrome resulting from loss of intestinal length due to a disease or a surgical reduction leading to gut function reduction below the minimum required. So there's a loss of length of the gut, which can result in a water deficit like volume depletion, macronutrient deficiency, as well as electrolyte abnormalities. So this is the definition of short bowel syndrome. So normal bowel length, small bowel length is approximately 275 to 850 centimeters. In adults, if it is less than 180 to 200 centimeters, remaining small bubble. If it is less than this, there is a high risk of malabsorption resulting in nutritional deficiency, electrolyte abnormality, and fluid deficit. So that is short bowel syndrome. The core problem is because of decrease in the intestinal absorptive surface and rapid transit. Okay, and for if you're talking about a pediatric patient, it is less than 25% of the small bowel for the gestational age. So this is the definition. So what is intestinal failure? So intestinal failure is not same as short bowel syndrome. It is mentioned specifically to refer the need for intravenous supplement. That is, it is the gut is not efficient at all. So there is a need for the intravenous supplement, parenteral nutrition, to maintain the health and growth. So this is intestinal failure. Okay. So this, because of this, the patient has a growth defect and very inappropriate gut function and requiring a need for parenteral nutrition, that is intestinal failure. So what is the etiology? Common in adults is Crohn's, acute mesenteric. Yesterday we saw acute mesenteric ischemia, which can result in, if SMA thrombus is there and the bowel goes into a gangrene, you'll have to excise a large portion of the bowel. So the remaining part, if it's less than 275 or 850, the patient can end up in short bowel syndrome. So radiation enteritis, post-surgical adhesions, and any post-operative complications. So in children, the most common complications being volvulus, intestinal malformations, necrotizing enterocolitis. So these are the etiological factors. So normal fluid absorption, approximately 9 liters happen in the bowel. Okay, so this much absorption of fluid happens through the small bowel daily. On an average, 7 liters in the small bowel and 2 liters in the large bowel. And where are the nutrients absorbed? Approximately in the jejunum, first 100 centimeters of the jejunum, most of the nutrients are absorbed. And last 100 centimeters of the ileum, vitamin B12, bile salts are absorbed. Magnesium is absorbed in the terminal ileum and proximal colon. So these are the places. The initial 100 centimeters of jejunum, last 100 centimeters of ileum. So these are most important points. And the impact of resection will be along with fluid, electrolyte, the major nutritional deficiencies will happen. So what are the phases of short bowel syndrome? These are the 3 phases. Acute phase in the first 3 to 4 weeks. And next happens the adaptation phase in the 1 or 2 years, followed by a maintenance phase. So the acute phase is characterized by severe metabolic derangement, intestinal fluid loss. So there will be hypersecretion due to lack of inhibition by hormones. There will be severe dehydration, metabolic derangement, acid-base abnormalities, electrolyte deficiencies. That is in acute phase. Next comes the adaptation phase, which involves the remaining small bowel increases the absorptive surface gradually and slow intestinal transit happens. The intestine tries to move slowly. The motility decreases. So why there can be some amount of absorption that can take place. So this promotes the absorption of nutrients, biliary secretions, and ileal and colonic hormones also. So this is kind of a compensatory mechanism that the intestine tries to do. And reversibility of chronic intestinal failure is more likely with the greater residual bowel length. If it all depends, the reversibility depends on the bowel length only, and the presence of ileocecal valve or colon. Okay, the length of the colon or the length of the intestine along with the presence of ileocecal valve. So if the valve is intact and the jejunolileal length is more than 35 centimeters, reversibility is more likely. If the jejunocolonic length is more than 60 centimeters and end jejunostomy, if the length is more than, so these numbers, if possible, you can remember, but just remember that the length along with the intact ileocecal valve, this is an important factor to determine the reversibility of chronic intestinal failure. So next comes the maintenance phase. The maintenance phase happens 2 years later. So mainly the patient should have the diet supplements like oral, intramuscular nutrients, parenteral nutrients. So all the nutritional supplementation should be provided in the maintenance phase. So what are the symptoms? Symptoms of malabsorption. Okay, malabsorption, malnutrition, weight loss, chronic diarrhea, high output fistula, steatorrhea, because steatorrhea, dehydration, electrolyte imbalances, severe hyponatremia, hypokalemia. So all electrolytes can be abnormal. Then vitamin deficiencies like A, D, E, K, so all B12, everything will be deficient if the terminal ileum is resected. So potential findings will be hyper secretion of gastric hypersecretion. There will be abdominal cramping as well. So complications. So what are the complications with associated with short bowel syndrome? One is D-lactic acidosis, nephrolithiasis, cholelithiasis, and metabolic bone disease. So these are the specific complications. D-lactic acidosis occurs because of fermentation of carbs by colonic microbacteria. The patient can have slurred speech, ataxia, altered mental status, and psychosis. Nephrolithiasis because calcium oxalate stones are produced. Cholelithiasis if the bowel length is less than 180 centimeters, and metabolic bone disease because vitamin D is not going to be absorbed. So there is another complication, important complication, intestinal failure associated liver disease. So this is because of long-term supplementation with parenteral nutrition. So because of parenteral nutrition, there will be cholestasis, steatosis, steatohepatitis, ductopenia, and fibrosis. Some infants can develop rapid fibrosis progression, and it is a very fatal condition because the mortality will be 60%, especially in pediatric population. So these are the various complications along with our nutritional deficiencies and malnourishment. How can you manage? Main nutritional aspect, how we can manage, and specific therapies. Nutritional aspect, we just need to supplement early parenteral nutrition and try to supplement with enteral nutrition. So if the patient develops liver disease, intestinal failure associated liver disease, consider adding fish oils and try more oral, decreasing the TPN. Hydration, electrolyte corrections. If D-lactic acidosis occurs, stop the carbohydrates and then supplement with other forms, more of proteins and fatty acids and amino acids. Just decrease on the carbs. Antibiotics, hydration, and thiamine can improve D-lactic acidosis. Bone disease, supplement vitamin D and bisphosphonates. These are specific for complications. Okay, advanced therapies. What can be done is reversal or interposition. Surgically, there can be some interposition of segments that can be done. Some suturoplasty, lengthening, transplantation. Intestinal transplantation is something that can be considered in these patients. Okay, intestine indicated if the bowel length is very, very small. less than 60 centimeters of bowel with parenteral nutrition related complications like intestinal failure associated liver disease. And some hormonal analogs like to decrease the secretions, teglutide. So this can be used. So prognosis on the long term, it all depends on the age of the patient and the underlying disease and the length of the intestine. Less than 60 centimeters, the patient will be on prolonged lifelong parenteral nutritional support. It is one of the indication for transplant. So and also presence of ileocecal valve improves the independence. So this is about